You're listening to the Smart Policy Podcast, a production of the University of Tennessee's Institute for Public Service. A cop, a guitar company, and a public health analyst walk into a bar and mount an opioid overdose first aid kit to the wall. We've covered the Training and Empowering Musicians to Prevent Overdose, or TEMPO project before. Specifically, the effort to get these high-tech naloxone kits called ONEboxes into easily accessible locations where they may be treated no differently than a defibrillator, an essential first aid device for a modern establishment. The program was so immediately impactful that it spread to Knoxville, where, as in Nashville, a life was saved within a week of the ONEbox installation, and more recently into Chattanooga. However, efforts seem to have stalled in Nashville until the right combination of partnerships at the city government level took the program to new heights that surprised everyone involved.
Without even one of those pieces, this may not have been successful.
That's Benton McDonough, Director of Nightlife through the Mayor's Office. It's a newly created position intended to act as a liaison between business, government, and residents, which in a city like Nashville seems as essential as the music itself. We're coming out of the era of COVID, after all, when many businesses had gotten used to seeing local government as an enemy, when a lot of trust between the private and public sector had been lost. But this program shows that with the right policy, and more importantly, the right relationships, you can start to rebuild that trust.
At the local level, you cannot hide from anyone.
That's Erin Evans, Chair of the Public Health and Safety Committee on the Metro Nashville City Council. During the course of my interview with Benton and other stakeholders, it became abundantly clear that I needed to have her on this episode as well. After all, this is a situation where the legislative and executive branches of government are working together. And that teamwork is also a perfect illustration of why it is so critical to not overlook local government.
Well, first, thank you for having me on the show. I really do appreciate that, and I think this is a very important topic. But my name is Benton McDonough, and I'm the Executive Director of the Metro Beer Board, and also the Director of the Mayor's Office of Nightlife for Metro Nashville.
You know, our mutual friend Trevor Henderson, our Middle Tennessee substance use response consultant, he sometimes refers to you as the Nightmare. Is that your unofficial title?
That is used interchangeably, and depending upon your accent, it can come out a little differently sometimes. So some people call me the Nightmare. So I like to tell them that sometimes that's a fitting title, but I've been called much worse, I'm sure. So.
Well, homophones aside, it made me think of Batman or
Right.
Something like that. So what exactly is this job like? I mean, of course, on its face, it makes a lot of sense. Nashville's a big tourist town. There's a lot of shows happening there all the time, a lot of amazing attractions. So that seems, necessary to make a whole position for it.
Exactly. And it's hard to describe because it seems like I've been in the position now for about almost a year and a half. It just seems like it's ever evolving. It does have its original purpose, and I think that's a lot of what I focus on now is to basically be this liaison between the visitors to our city and business owners, their employees, the residents, and Metro government, and really tried to be a bridge between all of those entities. And so I say that it's ever evolving, but what I find myself doing really fits within those confines. And so I'm working on many different initiatives, one of those being distributing Narcan. And it's been really fascinating to see how the job has evolved to include these different initiatives.
You mentioned the distribution of naloxone into music venues. We've covered the TEMPO program, or Training and Empowering Musicians to Prevent Overdose, on the show in our November 2023 episode with then-director Dendy Jarrett of Gibson Gives, the philanthropic wing of Gibson Guitars. This has been going on from Gibson's perspective for a couple of years, I'd say a little bit before you entered your role. But how did you become aware of this, and what do you think changed?
Really was just by luck. Really, I was speaking with Erin Evans, the council member here in Nashville, and she asked me if I knew Trevor Henderson or Sergeant Mike Hotz. and she introduced us. We had a meeting over Zoom the next day, and within that weekend, we were starting to put Narcan in the bars. And so it was really just, a matter of us at the Beer Board and Nightlife using our experience and our contacts with the bar owners and things of that nature to work with them. Those relationships helped immensely. And so just reaching out to them and explaining the situation, and they knew about the issue with overdoses and things like that, so it was really important to them. And I was thinking about it the other day, and it's interesting that we have a lot of moving parts in this initiative, and each part is critical to the success of that initiative. And so, we have Trevor and Mike who have been working on this for a few years and, had challenges about getting traction on it. We have Erica with Gibson Gives who's providing the kits to us so that we can install them free of charge to the businesses. And then we have Councilmember Evans who, really bridged it all together. And so without even one of those pieces, that this may not have been successful.
That's an interesting collection of partners too. You have city council, you have mayor's office, you have an extremely compassionate and dedicated police officer, you have the philanthropic wing of a major guitar brand,
right?
And like you said, so many other people here, the business owners. So previously, when we interviewed Dendy Jarrett, back when he was director of Gibson Gives, you mentioned Erica Cruson. She now runs that. He spoke about the initial efforts of Tempo in Nashville, and it's an interesting conversation, but among the music venues themselves, there wasn't that much stigma to the idea of getting an overdose reversal agent into music venues. It was more so just concerns over liability. We've replicated the program in Knoxville and in Chattanooga, and if there was any pushback, it was on a similar level. Liability was a problem, concerns about perhaps public relations. Perhaps one venue didn't want to give the impression that this is where the overdoses happen, even though, of course, as you and I both know, they're happening everywhere, just about.
Right. Right.
There was an article recently in Nashville Banner talking about how there was this initial push, about 70 kits, but it wasn't until, as they attribute it, it was this unique partnership between not just the original Tempo partners and law enforcement, but also city government as well, that really increased this initiative. And now, Sergeant Mike Hotz, he's doing a lot. I'm getting photos from him all the time now of yet another box in there, and the manager or the venue owner is standing there proud next to it. There has definitely been a shift. How much can you attribute this, do you think, to buy-in from local government?
I think when you work on an initiative like this, I think the key to it is basically trying to remove any sort of obstacle that might prevent a business owner or bar owner, for instance, from saying no. I think it's taken time, and I just happened to come along at a time where Trevor and Mike had worked really hard, along with Gibson and Councilmember Evans. And so I reap the benefits of that by being able to provide my contacts and relationships and partnerships that we've built over the years.
I hear that a lot, relationships and partnerships. When I talk to most guests on this show, the connection between the mayor's office and city council seems like a really critical element here. And you don't always see that in cities. And even within the same city where you do see it, there's no guarantee that within the next administration you might, or the next city council elections, things change all the time with public offices. Do you think there's something to that relationship of Nashville's government broadly that might have played a role? Or is this just one of those issues that everybody happened to be in agreement on?
It's probably a little bit of both. I do have very good relationships with council members because, they have issues where a constituent is calling their office about something, whether it's a noise issue or something like that. And I'm just always willing to reach out on behalf of the council member and see what our office can do. And so I think the benefit of that is that you build that trust and you build that relationship. So I've been very fortunate. They're working on the budget now, and there were several council members who saw the benefit of supporting the nightlife office. And so I was very, very appreciative that they want to see, additional funding for our office because of doing things like this, whether it's the Narcan, like we're talking about here, or the safe bar training that we have in Nashville as well to go towards public safety. So
I'm glad you mentioned the safe bar training. That I think is really very related, and we can certainly go down that road. But I wanted to pull back and think, it's not just your relationship with other parts of the government. I mean, you play a crucial role in connecting with businesses, and there's clearly a lot of trust going both ways. And you spoke also about there being benefits to taxpayers. I can't help but think about the difference between this and related public health initiatives in contrast to, say, COVID. And we certainly don't have to unpack that. But it seems that there were several crucial differences there. And first and foremost, I mean, well, I don't know. There really is a whole lot to unpack here. I suppose the biggest thing here is huge agreement on what can be done and what should be done. And from business's perspective, it didn't seem to be so much a top-down mandate and more of a, how would you describe the differences, I guess?
A lot of times I think government wants to steer away from discussing that for obvious reasons. But
right.
COVID was actually, I think, a turning point in our relationships in a positive way with some of the bars and some of the businesses, because one of the things that we tried to do, and this was prior to my time as the director of nightlife, this had more to do with the beer board, was that we were able to pass rules and local legislation very quickly to allow for delivery and curbside permits for beer. And so people were able to stay open and still sell beer, which is where a lot of their income comes from, and obviously at a lot of the bars and restaurants. And that alone really helped build the relationships that I have with a lot of the bar owners. And that certainly, laid the foundation for, what we're doing now with Safe Bar and with the Narcan distribution.
So trust is definitely a huge factor.
Oh, very much so.
Would you have any advice for a city experiencing a rupture in that trust?
Find the small areas that you can agree on and that you can assist them with. And I think starting there is a really good point. You have to go into it with your eyes open and understand that you're going to have really good days, you're going to have really bad days, you're going to have days that are right down the middle, that sort of thing. So as long as you're going into it with, a realistic perspective, then I think that will definitely be a good start.
There were a couple of times that you mentioned in these initiatives the role of data. That is something that's definitely of interest here at SMART. And you've probably heard Trevor Henderson say the word data several times from our end.
Oh, yeah.
What role does local data play, do you think? And do you have any advice for, say, a smaller town that's considering any initiative in terms of how they might collect data?
I think data is critical to what we do in public service. I mean, I think people want to know where their tax dollars are going, and they want to know how it's being utilized. And so any sort of data that you can collect to show that your programming or your messaging is worthwhile or is making an impact, that's so critical. I think as far as, a small town or city that's thinking about, data collection, I'm obviously no expert, but I would say just finding areas that that you want to track, that where you want to see change. I think collecting that information and those data points is critical to showing your constituents that the service that you're providing is worth supporting and worth funding. It's something that we rely on a lot at the beer board. And I can recall that when I started with nightlife, I started thinking about what sort of data can we collect, and it really wasn't clear to me about how we do that until we started working on a lot of these initiatives and showing the work that we're doing matters. And so just in the responses that I see from the public, and also Metro Council, and in the way that they've really supported our office, has been so important and so critical. And showing that data to them as to why it was a good choice to create this office has been so important to the creation and the evolution of our programming. So, and I'm looking forward to what other data we can collect moving forward. So.
Okay, so it's not only about data for identifying a problem, it's showing your effectiveness as well as justifying why people should continue to support any given initiative then.
Exactly.
Yeah, so without the data, it's kind of hard to have anything, right?
Right.
Are there any frustrations you have when it comes to perhaps ignoring or negatively portraying local government?
I think sometimes, people think that Metro doesn't care about this or that because it's not something that's our main focus at the time, but it doesn't mean that we don't care. I think just reaching out to our office if you have any ideas on initiatives or any sort of thing like that you would like to see. Honestly, that's what happened in all of these situations was that someone reached out to my office to see how we could help, and we were able to really utilize the partnerships that we've built over the years to sort of move these things in the right direction. And so I think it never hurts to reach out to see if there's anything that we can do to assist. I mean, that's what we're here for.
At the county level, we've heard a lot of talk in other publications, other shows, what have you. How do I know what's going on with my county with the opioid settlement funding? And the advice is always the same: is to go to the meetings, go to the county government meetings, try and see who's got that spending. So it sounds like the same issue, that people just need to really embrace actually accessing their local government, and they may not realize how accessible it is.
Very much so. That's really the first step, is just reaching out to let us know that something's actually going on. Because, like people say, you don't know what you don't know. So if I don't know that it's going on, then I can't help you. And we may not always be able to reach the conclusion that individuals would like to see, but we're always going to try our hardest to create some balance between business owners and residents. And that's really the job that I was put in here to do. So is to be that liaison between Metro government and the residents and business owners and visitors. So I feel like we're seeing a lot of that balance work well for the residents, but time will tell.
Right. No, but I'm inclined to agree with the optimism, and it sounds like a very important responsibility. So I thank you for doing it. And like I would,
you always have to be optimistic in a job like this.
Right. Well, that's very true. Well, Benton, thank you very much for joining me on the Smart Policy Podcast. I appreciate it.
Thank you for having me, Jeremy.
So again, that was Benton McDonough, the Director of Nightlife for the City of Nashville, and also sometimes known as the Nightmare. And during the course of our conversation, it became abundantly clear that I needed to include Councilmember Aaron Evans on this episode as well, in order to better portray the picture of what effective local government can look like.
I'm Erin Evans, and I am on the Metro Nashville Council representing District 12, and I am chairing the Council Public Health and Safety Committee this year.
Your name came up many times when I was speaking to the various stakeholders. How did you get involved in this, and what role did you play in moving the pieces along?
So 2 years ago, when we actually went through a process of merging committees together, and that's when public health and safety came together for the first time. Previously, they were operated independently. And so I was chair 2 years ago of the committee with our first effort to kind of combine areas of interest and focus and kind of cross collaboration. And so there's been, I would say, kind of a focus amongst a couple of different, in addition to the Public Health and Safety Committee, a couple different caucuses within the council. So our Women's Caucus, this council term, we are now a majority of the council. We have 21 members, and so we're very excited about that. We also have a very strong Minority Caucus. And so there was interest in how can we really leverage some of that influence. And so the kind of the origin story of all of this effort, Benton McDonough was appointed to be the director of nightlife, and we also refer to him as the night mayor, in Davidson County. And so he's been building relationships through his additional job as the beer board director, for a while with our downtown entertainment kind of corridor. And so when the Women's Caucus last year really wanted to start working on some policy initiatives that impact, women and children, one of the opportunities we had was to work with the Sexual Assault Center in Davidson County on essentially promoting across the entertainment community the idea that bar owners should support the idea of bringing their employees together to have training on what to look for if someone has a drink that's spiked or adulterated in any way. And so we had this relationship with the Sexual Assault Center We had some success, working with them to get more bars to facilitate this training. But then we partnered with Benton McDonough with his relationships with all of the bar owner stakeholders and entertainment groups because of his efforts with the beer board and as the night mayor to really expand that work. So we kind of cross collaborated with him, invited him into that conversation. He got to know all the stakeholders, and then essentially he and his team kind of helped carry it forward and push it and promote it. And then we also involved our downtown District 19 council person, Jacob Coupin. And so that really helped expand that reach. So that's a very long-winded story, but those relationships were really key. And then when, I think it helps to have people that are curious when they see articles in the paper or on the news, to ask more questions and to seek more information. And Benton is one of those people that looks for more information and how can he assist with, making Nashville more safe. And so, his attention was caught by substance use issues. And of course, his insight into the downtown area and those relationships. Essentially, it was a matter of connecting him to the right people. So in this instance, I connected him to Trevor Henderson and then also to Sergeant Mike Hotz with MNPD, who I have gotten to form a relationship with 2 years ago because of my original kind of interest as the chair on substance use disorder. And so that's a very long-winded story, but basically it was about the right timing, kind of the making connections, and then people who are curious and want to know how they can kind of support initiatives like this.
I think there is often probably too much focus on the very far out, especially the federal. Federal is important. I'll never discredit how it's important to maintain at least some focus at the federal level. Important stuff definitely happens. But I do think local government, especially at the city level, often gets overlooked. Do you encounter that often? Do you think there might be some concern there?
Yeah, so local government is not as exciting, I think, from a public perspective as federal or even state government. Local government, we're the closest to the people that we serve, literally the closest, because I'm living next door to people that I serve. But, when you think about some of these huge issues, and I'll use like COVID as an example, when we were navigating like conversations around vaccinations and everything that went along, with that pandemic, there were times that I was like helping people make vaccination appointments, picking them up, driving them myself, those kinds of things. It's not the kind of service you're going to get at the state or federal level, but I think that there's a deep connection with local elected officials and to the people that they're trying to help, that there's maybe more of a personal interest in wanting to see people thrive because they're our neighbors. And I think the further that you get away, it's easier to kind of look at like a map or look at a spreadsheet and they're just a number. But really, like if I'm seeing people at the grocery store or at the gas station or, wherever it is that I'm seeing them, it's like a good reminder that I'm not just having these conversations for the benefit of me or my future interests. I'm having these conversations because I know that their lives may be impacted by the outcomes, that need to occur, or the direction or the strategy, that we take as a city. And so that is something that I think is really powerful. And I don't know, I've never served in Congress. I've never served at the state level. I don't know if those folks feel the same way or if it kind of resonates with them that way, but that's what I think about. It's like, what is the impact of the decision that we're making on the person, that lives in my neighborhood or that lives, in the apartment complex that I drive past on the way to work or, those kinds of things.
Oh, that's very well said. So more of a stake and more of just an inherent sense of, well, I mean, I live here too, but not to mention, I'd imagine the responsiveness is better. Of course, no one will have the opportunity to respond to absolutely everything that comes across their desk, but I would hazard to guess the proportion of responsiveness is much higher at the local level.
At the local level, you cannot hide from anyone. I have no staff members. There's no barriers between me and the world. And so that can be a great thing. I would say 99% of the time, it's a really great thing that I have that proximity to everybody that I'm working with and have that, to your point, kind of responsiveness, because there's also not that many barriers between me and information, at the local level. Like I know who to call, like with either the health department or the police or fire or, whatever department it is. I have a connection and I can get information relatively quickly compared to at the federal level. They have a lot of staff members, but there's also a lot of staff members, at the federal department side. And so there's a lot more to wade through. And so I can get to information quickly. Now, sometimes information is not great, or I have to deliver bad news or whatever it is. But at the same time, you kind of wonder less about the direction. And I can also explain my position a lot easier, I think, than people at a higher level can, because I'm unfiltered and I'm just sharing it. Like, this is what I think, and here's why I vote the way I do, or the things I considered that led me to a vote. And also to be able to get that input from residents directly who want to have a conversation. It's pretty easy to, like, let's go meet for coffee and talk this through, or hear from them at a community meeting and those kinds of things.
I think it's great that you have that level of engagement with your constituents. I'm also glad you raised the specter of COVID. I did the same with Benton, and it's always perhaps there was a concern that, having just come out of the era of a lot of people feeling like people were telling them what to do, especially at the business owner level, there was definitely a lot of pushback too. We saw this in cities all across this, not just the state, but the whole country. Was there a concern that there might be, oh, here's more of the same, here's more of the government just telling us how to do our thing?
Yeah, I think that's a great question. And I think that was probably some of the early response around, that we didn't need to come in with a stick. It needed to be a carrot. And of course, I think at their core, anybody who has a business trying to engage with tourists and residents, and they want people to have fun and have a good time, the core of it is they need people to be safe. Because if you are a city that gets a reputation as being unsafe, that is a terrible message to deliver to the world. And you want people to come to your city, have a good time, and at the same time go home, with memories that you want to remember and be able to share those with your family and friends. And so I think that was a delicate balance, but I think the message around why this is important, I think really came through, and that it was kind of a shared responsibility. Like, we know that this is a problem and people need to be warned with information. So at least they're making decisions that are informed. And so I think that, and then if they're informed and they're taking, something that may negatively impact them, then we at least need to be able to respond to it. So that way, they're going to survive. And so I think that was a message that really probably resonated with the stakeholders who likely, some of those folks have experienced overdoses themselves, or they have witnessed them, or had to respond to them on the security end, or whatever it is. And so I think that's another reason why it's been received well. It's that relationship, kind of the recognition, that Benton's coming in and he is not trying to put a hammer down. He's trying to appeal to, let's all work on this issue together.
In that same vein, drug checking equipment, and I'm speaking very broadly in an academic sense in that this could be fentanyl test strips, or it could even be in the vein of the safe bars, like those coasters that can test for the presence of a sedative, or of a particular class of sedatives like Rohypnol. What do you think is the relationship, at least right now and potentially going forward, of drug checking equipment like fentanyl test strips and the like?
Yeah, I know that our health department has provided, fentanyl test strips, and they were looking at xylazine test strips as well. I think that those are important tools. And and it's interesting just because, like, Sergeant Hotz at MNPD, so 2 years ago, he was trying to get a mass spectrometer, a portable one. So that way, when he was in the field, He could test, with investigative scenes, and then have an early indicator of what potentially may be creating a spike situation,
Mm.
across the county. And that's one of those pieces of testing equipment. It's pretty restricted, as far as like he was able to get it because of, being a police officer. I know our fire department also has one. It's one of those that I think is a really vital piece of equipment because it helps eliminate some of the barriers to knowing information
Mm.
early enough to be able to have a conversation across like a city or county stakeholders. And so that's like a super sophisticated piece of equipment. But, at the same time, it's like, I think, health departments having test strips, giving them out to nonprofit organizations, being able to encourage people to use those. And that's also something that Safe Bar has provided, as part of
Oh,
the materials that they have, is fentanyl test strips as well.
really?
Because
Wow.
I know we had like a Women's Caucus had a public meeting and specific to Safe Bar. And that was one of the things that was included in, like, here's all your coaster examples and everything else, and fentanyl test strips were included. So I think they're really important to have those things. And I hope that more counties are availing themselves of those options since they were decriminalized to help behavior change to an extent, at least raise awareness that there may be something serious, and something that you're about to take.
So the bill that does decriminalize fentanyl test strips specifically, the language is testing strips designed to test for the presence of a synthetic opioid, which fentanyl and its analogs are. But that's a very particular definition. It doesn't include xylazine. Xylazine test strips are legal because currently xylazine is not a controlled substance.
Right.
That could change. But benzodiazepine test strips, technically illegal, and benzos are on the rise. We see this from our medical examiners across the state. And I may have already mentioned this, but the law automatically sunsets next summer. So I take it that you would like to see that continued.
Yes, definitely. I think if you let the law sunset, what are we going to do then? We're just going to be like, okay, when you're dead, we'll test to find out, what drugs you died of. I
Right.
mean, that's the kind of, place where we are. And so kind of looking at opportunities to reduce kind of the harm to people that may be in a position where they're using substances, because the goal ultimately, Sergeant Hotz does it so well, like, keeping people alive so that way they can live to then hopefully want to go towards treatment. I think that's really a critical aspect of the work that he does. And, I don't think we can go back to saying, you can't use these. That doesn't make any sense to me. And I think it would really be unfortunate if the law is sunset. And will at our council level, we will try to work, with all the other city and county governments to focus on, let's make sure that this law doesn't sunset and that the legislature understands our position, because I think that's an important area that we all should put some attention on, when this next legislative session starts.
Thank you for putting the attention on it. I do think it's a important issue. It reminds me of what Dr. Stephen Lloyd, the chair of the Opioid Abatement Council, says. He himself is a treatment provider. He's, I've never figured out how to treat dead people.
Right.
Like you said, I mean, if you keep them alive, they might still be engaging in behavior you don't approve of, but they're not dead yet, and you could still get to them, is the thinking there. We are a policy-focused podcast. We did talk an awful lot of policy so far, but I was wondering if there were any other policies at, say, the city or county or state or even federal level that you would like to see that might do more for overdose deaths.
Yeah, that's a great question. So I think that, we've got this focus on ONEboxes kind of from a private business perspective, which is the area, that Director McDonough is working on with Sergeant Hotz. I think that, as a government, we also need to look at, like, what is our internal focus on how we're making naloxone available. We have a health department that gives out doses, the health department, you can physically go there, but making sure that is out in the community. And so we've had some challenges, I would say, in some of our government buildings, libraries in particular, because they're becoming like a new, kind of the same way that we've put a lot of social issues kind of in the school system. And then from a public perspective, our libraries and our community centers are also getting more engaged in like social issues. And there's some libraries in Davidson County where employees have taken upon themselves to like go out, get trained in how to use naloxone, carry some with them. It's purely voluntary on their part. But I'd like to see, how Nashville, Davidson County can support the libraries more around some of these issues. So that way, because I think the challenge of having like the health department, they've only got a couple of locations around the county, but there are libraries all over our county. And so how can we make sure that people have access to things that they need? And also if employees are willing to make sure that they can respond accordingly to somebody that may be struggling, with an overdose issue, how can we support them? Like right now, they're just doing it as one-offs. Employees that I've talked to, they're just wanting to be prepared because of their experiences at work. And so that's, I think, kind of one of those under the radar issues that we need to look at. How are we going to address it? Because I'd like to see ONEboxes in every metro government building. And I'd like to be, for it to be as routine as like we're checking to see if there's toilet paper in the bathroom stalls and, we have naloxone near, like the hard equipment and things like that in our building. So I think normalizing that this is accessible and we want people to live is really critical. And I want our government to be a leader. I think we're a leader in many ways. Our behavioral care center and our sheriff's office, they have a naloxone vending machine, because they're wanting to make sure anybody leaving the system, who may be opioid naive, that they have access to, a tool that in case they go out and, they use after they've been in the system, that they don't die just because they've been away from it for such a long time. So anyway, those are all the things that I'm thinking about. And we just have been going through our budget conversation. And so our chair's substitute budget does have some more funding to go towards ONEboxes. So that way Sergeant Hotz can continue his outreach. And so I think that that's a real victory that our committee and our budget chair kind of recognized the passion that Sergeant Hotz has for this issue, the passion that Benton McDonough has for this issue, and that, willing to help them continue to do great things and be able to educate more people and engage more people about how to respond and keep folks alive.
Those are some really excellent points. I think especially about the library. I volunteered at one in college, and I know exactly what you mean about them becoming more and more of a face of addressing social issues at the general public level. Is there anything else you'd like to add?
I think in general, like if there are any other elected officials out there, always be looking for who you can connect together to see what those relationships will end up looking like. I think, what I struggled with in my first term is feeling like I needed to know how to do everything and how everything worked. And the reality is, I don't really need to know all the details, but if I can figure out who the right people are that should know each other or should work together, that is way more powerful than me trying to learn everything about everything, because then I can look for opportunities to support the great work that those combinations of people can do together, as opposed to feeling like I need to be the one to kind of take on the ownership or the onus of feeling like I've got to solve all the problems. And so it's kind of like just get the great people together and then, watch them make magic or cook or whatever expression you want to use. But that's been, I think, probably the most gratifying part of the work that I've been able to do is connect people together and let them go, and then figure out how to support them.
That sounds like effective government to me. Councilmember Evans, thank you very much for joining me on the Smart Policy Podcast. It was a real pleasure.
Yeah, thank you for having me. I appreciate it.
For more episodes on in-depth discussions on Tennessee policies related to substance use disorder by a range of local experts, please subscribe to us wherever you get podcasts and visit our website at smart.tennessee.edu. I'm Jeremy Corvelis. Thank you for listening and see you next month.